The heart is a muscular pump. It squeezes and pumps blood out of the heart around the body. The heart then relaxes and fills again with blood, ready for the next pump. Blood pressure is the force that the blood exerts on the inside of the blood vessel or artery wall as the blood flows around the body. When you exert yourself, the blood pressure will rise and the heart has to work much harder to pump the blood around the body. If the blood pressure is always high, then the lining of the blood vessels will become damaged. If you smoke or have high cholesterol, this damage, described as increased wear and tear, may be increased.
How to understand a blood pressure reading. Blood pressure is measured in millimeters of mercury, mmHg, and is written as two numbers. So your reading might be 120/80 millimeters of mercury, though we usually say simply 120/80. The first number is the systolic reading and is the highest pressure when your heart pumps. The second number is the diastolic reading and is the lowest pressure when your heart is relaxed between beats. For people with heart disease, the first number should be less than 140. The second number should be less than 90. Unless you have diabetes, then the reading should be less than 80. If you have any concerns, please discuss this with your doctor or healthcare practitioner.
Lifestyle factors. Lifestyle factors can increase the risk of developing high blood pressure, and these include smoking, being overweight, lack of exercise, drinking too much alcohol, too much salt in the diet, and stress. Kidney disease may cause high blood pressure in a small percentage of people, but often there may be no particular cause. High blood pressure is common as we get older and can also be hereditary or run in families. High blood pressure increases the risk of heart attack, heart disease, stroke, heart failure, and kidney disease. The good news is that, in addition to lifestyle changes, there are many medications available to lower blood pressure. It is important as adults to have regular blood pressure checks and take prescribed medication if high blood pressure is diagnosed. Usually a 24-hour blood pressure monitor will be needed for diagnosis. But remember, it's also important to make any lifestyle changes that may be relevant for you, such as stopping smoking, managing stress, and reducing salt and/or alcohol. Regular exercise is particularly effective in controlling blood pressure. Controlling high blood pressure with lifestyle changes and taking prescribed medication correctly greatly reduces your risk of heart disease and stroke.